Good morning, everyone. Welcome to our first real lecture for general pathology. So first things first, we need to find out what pathology is. We need to understand what the subject is, so we will know what to focus on. We need to understand what is the coverage of what we're trying to study, so for us to be able to um, appreciate how this subject contributes to our future practice as doctors or dentists, right? So, pathology literally comes from the amalgamation or the combination of two Greek words. You have pathos and logos. Okay, pathos literally means suffering, while logos is the study of something. Okay, so pathology is said to be the study of suffering. Okay, so why would you need to study suffering? Now, the term makes more sense if we view it or if we communicate it in terms of the more technical definition, which is pathology is just the study of disease. Okay, so pathology is just that, it's the study of disease. Now, the question is, why do we need to study disease processes? Okay, why do we need to study all these different diseases? I'm not necessarily, I'll be a dentist, okay? I'm not necessarily a medical doctor, but what is the reason why we need to study diseases? Because it is important that we study diseases, because by studying diseases allows us to identify ways to manage disease. How can we cure the disease if we do not know how to approach it? How it causes damage to the body? How it enters the body? How does it cause the signs and symptoms? So this is the reason, this is one of the many reasons why we have to study pathology, because it allows you to do something about the disease, what medications to give, what surgeries to do. Okay? So that's one point. Another point, another reason why we need to study pathology is that it actually helps in the development of new treatment modalities. Okay? Now, case in point, let's look back at what happened in the past few years. COVID, the COVID-19 virus was completely new. Before 2020, no one knew what it was. Okay? And faced with a new organism, new virus, people didn't know what to do. It kept on spreading so fast. Nobody knew how to approach it, how to treat it. Okay, so by virtue of studying the molecular entity, okay, by looking at how look at the genome of the virus, we were able to identify how it was able to enter the cell, how it caused damage within the cell, and how it led to the signs and symptoms of the patient. And because of that story that we were able to extract by studying what the course of the disease is, we were able to understand, we were able to develop new treatment modalities. Okay? Now, pathology is said to be a bridge science. Okay? It serves as a bridge. Okay? Serves as a bridge between your basic sciences and your clinical sciences. Okay? I'm sure all of you guys might have wondered, Why am I studying chemistry? Why am I studying anatomy? Why do I need to memorize all these things? And the reason behind that is these subjects are your foundation for what you will be learning in the clinical sciences. Okay? As a doctor, um, one of the things that you need to realize is that you cannot do something about things that you do not know about. Okay? And I'd like to share a little anecdote. During my student years, I had the fortune of um, studying under um, a very good chemistry professor. His name is Dr. Mario. He's still here in Southwestern, and he came in from another institution around the same time when we were first years and second years, medical technology students, and he was known for um, very difficult lectures. It was hardcore chemistry, and um, because of that, he got a reputation for being one of the toughest instructors around. But even until now, his lectures, his foundation for chemistry, serves as the basis for practically all of my learning. To our advanced chemistry classes in medical technology, down to our chemistry classes in med school, and even until now, as a pathology resident, everything went back to his lectures and his initially very, very tough lectures. And I developed a sense of appreciation because it's very difficult to learn something if you do not have a steady foundation. And pathology serves as the bridge that channels what you know sa basic sciences nyo, anatomy, chemistry, and it bridges that sa clinical sciences nyo. Before you talk about treatment, before you talk about surgery, before you talk about management, before you talk about antibiotics, you need to identify how the disease is presenting and why the disease is presenting that way. You need to understand that before you can do something about the patient. Okay? And pathology provides that knowledge. Okay? Without pathology, it's very difficult to be able to come up with a plan to manage your patients. And that is the beauty of pathology. Okay? Now, pathology is generally divided into two. You have general pathology and you have systemic pathology. Okay? Our lessons will be focusing on this one, general pathology. Basically, general pathology is the general response of tissues and cells in the body when they are exposed to certain insults. Okay? It is the general response of the body, regardless of what organ it is. Okay? So, for example, if you cut a blood vessel, if um, you cut yourself and you severed a blood vessel, what are what are the processes that the blood vessels will undergo to try to stop and control the bleeding? Okay, whether it happens in the arm or in the foot or wherever in the body, the processes will remain the same. That's general pathology. When you have an infection, okay, what how do the blood vessels initially respond? How does the body try to identify the organism? How does the body locate the organism? How does the body mobilize the different components of the immune system to try to contain the microbial insult? All these processes remain the same regardless of where you are in the body. And that is general pathology. Okay? Systemic pathology deals with the specific responses of organ systems. Okay? It deals with the specific responses of organ systems. Like, for example, If there is a decreased blood flow to the lungs will react in a different way to try to shunt blood flow to the upper portions of the lungs where the air concentration or oxygen saturation is higher. So it deals with very specific responses that you will see in certain organ systems. It deals with specific diseases with certain organ systems. Okay, and that is systemic pathology. Okay, so general pathology is general response. Systemic pathology deals with systemics. Sorry, specific responses of organ systems. Okay, it's general versus systemic pathology. I hope that is clear. Okay, now the study of pathology is also divided into two: anatomic and clinical pathology. Okay, anatomic pathology is the visual study of organs and tissues, whether they are at the gross level, something that you can see with your bare eyes, or whether they are seen at the microscopic level, something that you will need a microscope for. Okay? So you look at it visually. Okay? So an example of a branch of anatomic pathology, um, you look at something that is wrong with your bare eyes. Example for this is autopsies. Okay? You open the patient up, you can see that there are nodules in the lungs that are yellow, that are friable. Okay? Those are actually TB lesions. Okay? If you have um, a large mass in your colon, that's cancer, that's part of autopsy. Okay? Now, another subdivision of anatomic pathology is microscopy, and this would include studying tissues and cells using microscopes, and we make diagnosis on what we see under the microscope. So, for example, grossly, if you open the patient up or if you did a biopsy, you can see that the liver is glistening. It's very greasy, and it has a yellow tinge. If you take biopsies of the liver, and you look at it under the microscope, that you will see that within the hepatocytes, within the liver cells, you see fat globules. Okay, that is steatosis. Okay, and that is representative of fat accumulation within hepatocytes. Okay, so that's an example of reading a microscopy, reading biopsy materials. Okay, and that's part of anatomic pathology. Okay, and what you see forms a picture of what's happening inside the body. um, there is something there's a causative agent that's causing fat accumulation in the liver. Okay, and grossly, because fat is yellowish to white, the cells accumulate a lot of fats, and this will be appreciated grossly by the accumulation of um, a yellowish material when you take biopsies, and it's glistening, it's greasy. Okay, so just by looking at it, it already tells you a story of what's happening inside the patient. Now, clinical pathology, on the other hand, is the study of body substances to try to form a picture of what's happening within the patient. So, whereas in anatomic pathology, it's visual. Okay, in clinical pathology, you are using body substances to try to form a story of what's happening. Okay, and this usually makes use of substances like blood, urine, stool. Okay, but a substances in the body, and you try to measure something, and these measurements will actually tell you what is going on inside the body of the patient. Like, for example, if the patient keeps on drinking alcohol, chronic alcohol abuse, alcohol causes a derangement of fatty acid oxidation. It also serves to mobilize lipids in the body. That is why over time, the liver cells in the body get damaged and accumulate lipids. Okay, the damage to the hepatocytes will cause the release of certain substances in the blood, and we measure these substances in the blood. Okay, the act of measuring that substance to tell you whether or not a disease is present is part of clinical pathology. Right now, let's talk about the aspects of a disease. Okay, let's talk about the aspects of a disease. It is not enough. It is not enough for you to be able to identify what causes the disease. It's not enough for you to be able to identify that cholera is caused by Vibrio cholerae. It's not enough for you to know that COVID is caused by the SARS-CoV-2 virus. It's not enough for you to know that AIDS is caused by HIV. Okay? Because the cause alone does not tell you anything. It does not tell you how it caused damage and how it's led to the signs and symptoms of the patient. Okay? So this is the reason why when we study disease, you're not just looking at the cause, but you're actually piecing together a story of how the disease came to be and how the patient developed these signs and symptoms. Okay? So when we talk about the aspects of disease, you need to start somewhere, and that somewhere is called the etiology. Okay? The first aspect is the etiology of disease. And basically, the etiology is what is causing it. Okay? So for example, again, cholera is caused by Vibrio cholerae. Okay? Um, Lupus, which is an autoimmune disease, is caused by the deposition of by the formation of antibodies against your DNA. Okay, so it's basically what is causing the disease. Okay, so that is the etiology. But much more important than etiology is pathogenesis. The pathogenesis is said to be the sequence of events caused by the etiology that leads to the development of the disease. So pathogenesis is a process. Okay? How is COVID able to produce disease? How is cholera able to produce massive diarrhea? How is AIDS able to produce susceptibility to a lot of infections? The process by which the etiology causes that is known as the pathogenesis. All right? So pathogenesis is the story, and this is actually much more important than the etiology. And when we study diseases, we need to concentrate on the pathogenesis. Okay? Now, this sequence of events will ultimately lead to changes in the biochemistry, some in the genetic level, which would lead to changes in the biochemical level. And these biochemical changes will, of course, manifest in the cells and the tissues, and finally in the organs. Okay? I'd like to go back to my example about cholera. The etiology is Vibrio cholerae, which is a rod-shaped organism, right? Rod-shaped bacterium. Okay? Now, Cholera serves to upregulate a chloride receptor. It opens up a chloride receptor in the cells, which leads to massive efflux. Lalabas yung chloride ions. It leaks out of the cell. Okay? Once it leaks out of the cell, we know that wherever chloride goes, sodium follows. And wherever sodium goes, water follows. Okay? Lalabas yung chloride, sasama yung sodium, and wherever sodium is, water follows. Okay? So, this of course leads to massive, massive, massive diarrhea. And you could actually lose liters and liters of water in a single hour. That's how dangerous cholera is. Okay? But my point here is that you have the organism, you know what the organism is doing to the cells, and you know the after effects of those changes. That is pathogenesis. Okay? And these pathogenesis, as mentioned earlier, leads to changes in the cells, tissues, and organ levels. And this is what you see under the microscope. This is what we study in anatomic pathology. The values, the dehydration brought about by the massive diarrhea, we can measure it using electrolyte levels. That is what we study in clinical pathology. Okay? And of course, this leads to the signs and symptoms of the patient or the clinical manifestations. Now, we often use the term signs and symptoms interchangeably, but we need to be able to differentiate how the two terms differ from one another. Now, whenever we use the term symptoms, whenever we use the term symptoms, basically these are the complaints of the patient. I have a stomach ache. Okay? I have a toothache. I have congestion in my nose. So these are felt by the patient. Felt by the patient. Or complaints by the patient. Signs, on the other hand, are what the physician or the doctor observes. Okay? So for example, the complaint might be, the symptom might be, I don't feel so good. I'm feeling hot. The sign is fever because this is manifested as an increase in temperature. Okay? I have a cough. I have difficulty breathing. That's the symptom. But what is the sign? The doctor auscultates and listens for wheezes. Okay? That's a sign that is elicited by the doctor. So essentially, pathology traces what you know about what's causing the disease down to the process, down to the manifestations of the disease. Because by knowing this process, you will be able to develop treatment modalities to cure the disease or to alleviate the symptoms of the disease. All right? So I hope this is clear. If you have any questions, please post them in the stream and I will try to explain and reply right away. Right? Thank you very much. I will see you on the other side. Bye bye.